guys, welcome again to my channel. This is Dr. Paramount, a go-to destination for orthopedic insights and practical knowledge skill. I have with Dr. Castabola. Last week I talked about the preliminary stage of Smith fracture management, and I did just some justice to it. So in coming lectures, I will talk more about the full management, what are you going to get from Smith fractures. So today I'm going to be talking about bony prominences. As a technician or as a technologist, as a student, you have to get some idea about the bony prominences. What are the bony prominences in the body? So, because there's no way you're going to apply a cast or treat a patient without having the knowledge and the idea of bony prominences in the body. So, when we talk about bony prominences, when we talk about a bony prominence, when a bone is prominent, what are we trying to say? What are we talking about? A part of the body with limited subcutaneous tissue over a bone. What I'm trying to say is that when we have a particular side of the limb where the bone is not covered with a lot of things, it's not covered with a lot of muscles, it's not covered with a lot of ligaments, so the bone is closer to the exterior part of the body, the surface, the skin aspect. So when we have a bone like that, that is what we refer to as bone prominence. So as a technician or as a technologist, you have to get the mindset of notifying or identifying some prominent area in the body. So when you apply a cast, there has to be some special attention you must give to the prominent area in the body. So the way you treat other limbs, the way you treat other places while applying your cast is not the same way you're going to treat the prominent area. So when you reach some prominent area in the body while applying your autobahn or while applying your cast, there has to be some special attention you're going to give to them. So while padding, you have to give some special attention. The way you pad the prominent area is not going to be the same way you pad the remaining part of the leg. So very quickly, I'm going to be sharing some bony prominence we have in the body so as to get the knowledge when you apply a cast or as a student trying to navigate some fact out of orthopedic courses. So you have to get the knowledge of bony prominences so as not to get the patient into trouble while applying the cast or while trying to save the life of the patient, so as not to give the patient more complications. So very quickly, I'm going to be talking about the bone prominent area we have in the body. Number one of it we have here is the shoulder joint. So at the shoulder joint, we have several prominent bone there at the shoulder joint as a joint in whole. So at the shoulder joint, we have something we call coracoid process of the scapula. So the scapula that is at the back side of here is coming to this side. So there's something called coracoid process. If you touch it, it is palpable. You can actually feel that no, this bone is actually closer to the surface of the skin. So there is no way a pressure is going to be exerted on this kind of places, and there will not be pressure, there will not be problem on the bone. So coracoid process is when you compress all these things together around the shoulder joint. That's where we have one of the prominent areas. So where as a student, if you are padding that place or you are applying a cast, so once you reach the shoulder joint, you make sure you apply more padding to that particular place so as to cover that place with enough padding, because when the POP is coming directly, the POP is not going to rest on the prominent area, because that place is not to be compared with other places in the body. Other bones we have in the body, there are some muscles that are covered there, they have encased there. But the prominent area are having issues because they have less muscles and they have less tissue covering them. So having understood that this place is a prominent area, followed by the elbow joint. At the elbow joint, there are some prominent bones there as well that come together to form this joint. So the first of it, we have the supracondylar process of the humerus. So we have it here, we have medial and lateral supracondylar. So when you touch this side, it is palpable. You can actually feel something. You can feel a bone outside. It's like you literally remove the bone out of your body. So when you are padding this kind of places, you make sure the kind of padding, the rate at which you pad this place is not going to be the same way you pad your shaft, the shaft of ulnar radius now. So when you get to the elbow joint, you make sure you cover them with enough padding so that when the POP is coming on the autobahn, the autobahn would have encased that particular bone so as not to get contact with the POP, so as not to exert pressure on it. So apart from the supracondylar process of the humerus, one of the major prominent we have there is what we call olecranial process and coronary process of the ulnar bone. So this must be given attention, that this place, elbow joint, is one of the prominent area in the body, and it's not ordinary elbow. Inside elbow, we have some places that I've mentioned, supracondylar process, both medial and lateral, of supracondylar process of the humerus, and also we have olecranial process and we have coronary process of the ulnar. So little of this, when they come together, they form something we call prominent, because they are easily touched, they are easily fractured, they can be easily broken. So padding must be given to them in essence. So moving forward, we have something we call wrist joint. Wrist joint, this joint is also a prominent area in the body. So there are bones that come together in that place that's going to form that prominence we are talking about. First of it, we have the stylar process of the ulnar, and we also have the stylar process of the radius. So we have then here stylar process of the ulnar and stylar process of the radius. So when you touch it, you can feel them that they are almost getting to the exterior part of your body. So the kind of part that you are going to put when you are applying something to this side is not going to be the same way you are going to put when you are applying something to this side. So this side can easily be fractured with a lot of stress. When this place undergoes several stress, it can be fractured or injured easily. So in that case, you have to pad this place very well and to give special attention to them. Apart from that, we have some of the carpal bones that are prominent in nature as well. In short, this joint is also a prominent area. We have this joint, and we also have this joint as well. So moving forward, we have the hip joint as well to be a prominent area, and associated organ and the associated tissues there. So first of it, we have the iliac crest. When you notice the nature of the iliac crest very well, on top of the hip bone, so it can be felt. If you put your hand on it, it can be felt. So that place is closer to the exterior part of the body. While applying some cast, a cast like hip spiker, a cast like body jacket, some body jacket can extend to that iliac crest. So in that case, you have to give attention, special attention to the iliac crest very well, because it can be pressured easily. There are little muscles that are covering them. So apart from the iliac crest around that joint, we have something we call ischial tuberosity. Ischial tuberosity is at the base of the ischium, the sitting bone. So while you are sitting down, there are the bones you are sitting on is called ischial tuberosity. So if there's a fracture towards this side, or there's a management that includes this bone, hip bone to be precise. So this area must be given attention, because you are going to be sitting on it. So special padding must be given to them. So apart from all this, there's something we call greater trochanter of the femur. So on the femur bone, we have something we call greater trochanter. That place it bulges out. That place is pointing out to the exterior part of the body. So if you touch it, or if you have a patient that is complaining of pain, or as a student you have to study anatomy and notice those sides very well, that is closer to the exterior part of the body. So you have to give attention to this as well. This is also part of the prominent area. This is also part of the prominent bone, the greater trochanter of the femur. So that's another part. So when we move down to the knee joint, the knee joint is also a prominent area. There are prominent bones there. A typical example of it is the medial and lateral condyles of femur. So the lateral condyles of femur, they are also prominent because they are closer to the skin at the medial and lateral side. So getting to tibia as well, we have the tibia, we have the medial and lateral condyles of tibia as well, connected inferiorly to the femur. The condyles of femur are the superior, where the condyles of the tibia lies at the inferior aspect. So another bones there that is prominent is what we call tibia plateau at the middle line of the head of tibia. So there's something we call intercondylar eminence or tibia plateau. That place is pointing out towards the anterior aspect of the tibia bones. So when you study the bones very well, you notice all these bones are closer to the skin, and they can be easily fractured when they undergo pressure. The rate at which other bones will exert, they will adapt to pressure, and they will not be fractured or they will not be injured. cannot be compared to all these prominent bones. They can be fractured easily, they can be injured, they can be pressured easily. So at the knee joint as well, the last bone there I'm going to be talking about that is prominent is what we call the patella bones. This is very, very important as part of the bone that form the knee joint. Patella is a sesamoid bone to be precise. So this patella must be given attention when anytime you want to apply a cast that is above knee cast. When you get to the knee joint, you have to pad it very well, pad the patella very well, because the patella is somehow close to the skin and can be injured very, very easily. Moving down to the ankle joint, we have many bones there that is also a prominent bone there. One of it is what we call the malleolus. We have the malleolus of the tibia, we have the malleolus of the fibula. So at the distal part of the tibia and fibula that forms the ankle joint, we have the malleolus there, malleolus of the tibia, malleolus of the fibula. When the two of them come together, they form malleoli. So the malleoli they are prominent as well. Any cast you want to apply that will pass through the ankle joint must be given attention to. When you go to the ankle joint, both the medial and the lateral malleoli, you must pad them very well. And also, another bone there that is very prominent is what we call the calcaneus. Calcaneus is one of the tarsal bones we have in the body. One of the bones that forms the foot. We have 7 tarsal bones. So one of them, or the biggest, is what we call the biggest among them all, among the tarsal bones, is what we call calcaneus. The heel side of the part, the heel side of the foot is what we call calcaneus. So that bone, when you are padding or when you have a cast that must include that particular bone, there has to be some level of padding and some level of concern you are going to give to that particular place, because they are very, very prominent in patients. So one of the things I'm going to be talking about, they are not bones, but is one of the things that must be given attention to is what we call Achilles tendon. So there is no way you want to apply a cast to any lower extremity that you will not pass this tendon. Achilles tendon is the one connecting directly to the calcaneus. Achilles tendon is the longest tendon we have in the body that is connected to the gastrocnemius muscle that is coming from the hamstrings muscle at the thigh. So Achilles tendon, it is closer to the exterior part of the body. So that place where you are applying the cast or where you are applying your autobahn, you must give attention to that place very well. You must pad it very, very, because it is so much closer to the skin. So all this must be given attention. If you notice my lecture very well, based on this lecture, almost all the prominent bones that I've talked about has something to do with the joint, the shoulder joint, the elbow joint, the wrist joint, the hip joint, the knee joint, and now the ankle joint. So basically, I've touched some joints in the body that is the fact that they are one of the places that accommodate the prominent bones in the body. That they are not the only ones that accommodate. We have some other prominences, bony prominences in the body that I've mentioned about. Some of them are the occipita, the bones of the skull, the back side of the skull. So when you have anything that has to do with skull injury or skull fracture, this aspect must be given attention to very well, because it is so prominent, more than any other places, because you have to rest on it and you have to do some things through the back side. So occipita is one of the prominent bones we have in the body. So when you consider the facial bone as well, we have something we call zygomatic bones. These are zygomatic bones. We have one here, we have one here. So this place is more prominent to other part of the facial bones. Other part of the facial bones, we have many of them. But this zygomatic is so much prominent. So how will you conquer this kind of pressure? How will you conquer this kind of problems? You don't want your patient to be undergoing series of issues even after the cast application. So what are you going to do as a student or as a technician trying to put some things together, trying to get some basic knowledge about padding of bony prominences? There's something we call felt. Felt is a special protective material that is designed for bony prominences. So this orthopedic protective material is so much easy in such a way that it has enough foams inside it. So once you apply it to that particular place, once you just apply it to that particular, be it the elbow, be it the shoulder, once you apply it, is going to accommodate everything. No matter the proximity the bone is to the exterior part of the body, the felt is going to accommodate them so as not to get caught up with the cast. So if you are in a place or you could not afford felt, that is when you use autobahn. Autobahn, the normal protective material we use to pack all the bone, all the body. But when you get to the prominent area, the one I've taught you, you are going to pad them very well. You don't follow the 50-50, you pad it 100 over 100, 100 that is the full autobahn over full autobahn over full autobahn. You don't do 50-50. So when you go like 3-4 times before you continue. So by doing this, you have accommodated all those bones so as not to be pressured. Now, if we don't follow the normal process as a technician or as a student, trying to get the knowledge, if you don't follow the normal process of this and you apply it the same way you apply other part of the pose, and it is pressure, there are some complications that can arise as regards these bony prominences. If they are not treated very well, there are some complications that can arise as regards this bony prominence we are talking about. One of it is pressure sore. When the bony prominence is pressured too much and there's no covering, there's no autobands are not much there, so they are left with little autoband. The POP is exerting pressure on the bony prominence. There has to be something called pressure. So pressure will be set in and it will lead to ulcer if care is not taken. So if this leads to ulcer and your patient keeps complaining all the time, most patients may not even know. So at the end of the day, it will lead to something that you will not be able to undo. Either you destroy the cast or the patient is on the verge of losing his particular limb, which may later lead to amputation. So all this must be given attention to in order to avoid pressure, in order to avoid plaster sore, in order to avoid pressure sore as well. So it can also lead to delay in healing process in the sense that if the particular place you are trying to heal, the bone you are trying to heal, you have reduced its healing, you are causing another pressure on another bony prominence that is not even fractured before. So there will be ulceration, there can be plaster sore there that will lead to another problem that you will later face at the end of the day, neglecting the fracture site. So all this must be given attention to, and if you have found yourself in the situation like that, you have applied a cast and sore, pressure sore comes in, ulceration comes in, what you have to do, you may not remove the cast, what you have to do is just to create a window in the axis. So guys, that will be all for now. Feel free to go over the lecture again and get some things right about the bony prominences and how to treat them, how to protect your patients from being up by the plaster of Paris or any pressure thing or any materials that can cause pressure to your skin, to your patient's skin. Alright guys, so that will be all for now. Do well to subscribe to this channel and do well to like, do well to share, because it's only on this channel I give you updates concerning the management of fractures and fractures only. Alright, good. That will be all for now, guys. Next week is going to be awesome. Next week is going to be perfect. Next week is going to be hockey. So next week I'm going to be having a conference lecture discussion. So you won't want to miss that class. It's going to be full of orthopedic insight knowledge. It's going to be full of practical skills. It's going to be full of insight into orthopedic setting. It's going to be full of some management of fractures across all the joints in the body, across all the bones in the body. It's going to be a conference lecture discussion. So as a student, I recommend this. I will recommend this for you. Don't miss that lecture. It's going to be coming up on my channel next week, Thursday, and I want you all not to miss that lecture. See you there.